Okay, this is WA Winnie XA. I'm acting net manager today. Jay's not available. I'm located on Cape Cod, Massachusetts, where it's a very cloudy day and kind of cool. So we're ready to start the Mirko Digital Voice Net, and I'm going to be calling for stations in a minute. I just want to see if we can get the kind of regular rules down, as everybody knows. This is being done on QuadNet, which allows multiple modes, but unfortunately we have to give it time to synchronize all those modes. So please only speak about 2 minutes and then drop it and let it synchronize. And don't tailgate on one another. Leave enough room between it to give all of those connections a chance to connect. So, calling the Marco Digital Voice Net. Check in now. Go ahead. WJJ. This is KD4 Isaac. WA3 QWA.
N5 RTF.
PY2 BBQ Hilton São Paulo.
K3FZT, Philadelphia.
WW6AA, Long Beach, California. Okay. I got PBQ, Hilton, K3FZT, Stephen, WJ8B, KD4IZ, WA3QWA, N5RTF, and WW6AA. Is there any other stations? Okay. Don't hear anything to anybody else. Of course, if anybody comes in, we'll take calls later. And I don't really have a topic for today, so why don't we do our normal go round and give everybody a chance to tell us what's going on in your area. We'll start with Hilton since he came on first and set up the. Oh, by the way, we are on the YouTube, so if anyone needs the link, Hilton will gladly give it to you. We're not on Lettenlarger, but I think Hilton has got control of that. So why don't we start with PBC, PB2, PBQ, WA Winnie XA.
Okay, WA1EXA Mark, thanks. This is PY2 BBQ, returning to Marco DV Net. Hello, everybody. Hello, it's a little early for you for a BBQ, but not for us in São Paulo. It's midday right now. So good morning. For those who don't know me, it's Hilton from São Paulo, Brazil, general surgeon. And as we have been doing every week, we are broadcasting this net in the YouTube. To find the transmission, just need to type in the search at the YouTube. You need to type Marco DV Net, and you'll find the Marco DVNet channel, and there you can find all the previous nets, last 2 months, and also the live transmission of today. So we news from COVID-19 here in Brazil. They are still not good. We are still with an average of 2,000 deaths daily. It decreased from the last few weeks. Wait one. Okay, this is PY2BBQ returning. Although it decreased from the last few weeks, 2 weeks ago, the lockdown measurements of the government was loosened, and in the last few days we have seen a slight increase in the number of patients in the intensive care units again, like a third wave. And we are especially concerned that is being found the mutation from India in patients here in Brazil. So we are really afraid of a third wave this time. The vaccination goes on, and the good news that we have access to the Pfizer's vaccine as well. We have more than 60 million doses already administered. 40 million people received at least one dose, and 20 million people already received two doses from the three vaccines. Most people received the Sinovac laboratory from China, two doses, and about 10% the AstraZeneca's and Oxford University vaccine. And in the last few days, we started the vaccination with the Pfizer's vaccine. So that's the story down here in São Paulo, Brazil. Back to the net control, Whiskey Alpha 1 Echo X-Ray Alpha, PY2 BBQ.
Okay, Hilton. I'm sorry about your call. Yeah, it's really not that early here, but I'm just not awake. It's good to hear that things are starting to break up a little bit, and I hope that's true with all the rest of us. Let's go to KEFPT. Stephen, if you're still there, you said you were going to be able to stay for a little while, so over to you.
WA1EXA, this is K3FZT. Steve, Philadelphia. So Philadelphia is still a relatively hot area. The more socioeconomically depressed parts of town have been hard to reach for vaccination. And we are lagging the totality of the Commonwealth of Pennsylvania, both in vaccinations and in anticipated dates for opening things up, so to speak. All that being said, my wife and I had dinner last evening in a real restaurant. We had previously, a week and a half earlier, had a small supper in a local pub. And there were good crowds and a fair amount of protective stuff in place. Each of the booths had plexiglass panels 4 feet up above the booth top, framed plexiglass panels so that they were pretty sturdy and pretty prominent looking. That's about it here. It's a lovely day, 90 odd, I think it's 92 or 93 degrees is our anticipated high. A little early in the year for that kind of temperature. Back to you, Mark, and the net. This is K3FZT.
Okay, K3FZT, Steve. Nice to hear things are a little better there. And I'm hopefully going to keep processing that way. Okay, over to WJ8B. Your report?
Good morning, everybody on the net. This is Andy out in November Delta Yankee, located right now near Piketon, Ohio. That's between Columbus and Portsmouth. I'm on the way to Portsmouth. Here in Ohio, things continue to steadily improve. There still could be improved vaccination percentages. Now they are pushing on the lower socioeconomic groups. They even have a prize for those who have been vaccinated or get their vaccine. It's a free chance for $1 million lottery ticket, a winning ticket, I should say. And for those under 18, it's a ticket for a full ride college tuition, room, board, and everything. So that's actually helping to some degree. So the numbers have slowly dropped, both deaths and hospitalizations. Not quite as successful as some other areas of the country, but sounds like a little better than what you were talking about there for Pennsylvania. So it's 78 degrees around that right now. It's supposed to be 88 by the end of the day. So everybody have a good weekend, and back to you, Mark, from WJ8B.
Okay, Andy. I'm glad to hear you're holding out okay. So next in line, Jack. KD4, you said, I believe. Over to you, Jack.
Okay, I'm going to keep it real quick. I'm mobile. Been doing other things this morning, but I will be listening. So I don't have a report. Always good to hear everybody, and thank you for picking up the reins and running it this morning. Before I said back to that.
Well, that was quick. Very good, Jack. I know sometimes we mobile, you don't know if you're gonna how long you're gonna stay in, but no problem. WA3QWA, Mark. It's you're up next.
All right, very fine, Mark. This is Mark, WA3QWA. I'm a foot and ankle surgeon located in Chesapeake, Virginia. Virginia is getting better. We have a governor who is a pediatric neurologist, so he's been on the balls day one. Not with the percentages vaccinated, I had heard up to 40-something percent. So he's working very hard on the low-income areas. So hopefully we'll get that 60% and move towards herd immunity. WA3QWA.
Yeah, I know everybody's trying to work towards the 70% herd immunity, and then slowly, I think we're getting there.
In the Atlantic Ocean, and tropical disturbance moving ashore in Texas this morning. So we're really watching the Gulf from this point until all the way through into December. And I'm as I talk on this Pi-Star, I'm trying to think of the uses it might be put to in hurricane season when normal repeaters and things go out. Of course, you're still dependent on the internet, but even that you might be able to do some stuff with solar panels and cell phones. Wait one. As far as we're going with um, COVID, we're gradually inching up as far as the vaccination rate. There's still a lot of people that refuse, but the number of cases seems to be going down steadily, and we have finally opened up the city mask-free, and we're starting to get some tourism again, which is the lifeblood of our economy. So things are really looking up, and people are a lot happier than they were just a few months ago. That's about it for now. N5RTF.
Okay, and N5RTFWA when EXA. It sounds quite a bit like Cape Cod up here. Chip, one question. Tomorrow's general rain rounds. Would you just I'll send you a copy of all the people that are on today, and if you can just report it out to Warren, I'd appreciate it. Is that okay?
Yeah, that would be fine. By the way, I am streaming the net today and recording it, so it'll be by this afternoon. It'll be posted and available for anyone that wasn't able to check in this morning. N5RTF.
Okay, very good. You might mention that too. Warren doesn't get to me. By the time I check in, and then I think he turns his antenna, and that's the last he hears of me usually. Let's see. The last one I have on my list, and we'll see if there's any more. Merrill and WN6AA out in California. Go ahead.
I hope you mean WW6AA. Hello, everybody. It's Merrill here, and Long Beach, California looks like there's no. So I respond to that, and I'm new to Marco. This is Doug, and as I've told Jay, I've had a very, very complex life. Raising a family, raising a practice. I have two QTHs, one in Switzerland, one in California. I'm a skier, a hiker, backpacker, and a portfolio manager. And so the pandemic forced me to sit down, and that's what got me back into Marco. And my observations are, I wish more of you would put your information on QRZ. Andy, Jack, and Mark have wonderful sites. And when you go online, I get to look on there and get much more information about each of you. And if we're experts in communication, I think we should use it to the max. And having said that, I'll relate to the group that I'm 82, and then my psoriatic arthritis is driving me crazy. If any of you medical people out there have insights, I'd like to hear them. WW6AA is listening.
Okay, sorry about that, Merrill. WW6AA. I can't read my own handwriting. Yes, that's right. There's no more end calls. Sometimes I go back to my old days, and I come up with end calls. Well, it's glad to have you. We welcome you to the group, and we're here every Saturday morning at 1500 GMT, which on the East Coast is 11 o'clock in the morning, but I know it's 3 hours difference there. Okay, very good. Let's take a break and see. Is there anyone else? Is there any other one who wants to join the Marco Net? Go ahead.
Victor Echo 7 Bravo Sierra Papa, Richard in Victoria, British Columbia.
Victor Echo 7. I didn't get the rest of the call, but you can give it to me next time. Okay, go ahead. You're up. WA with the XA.
in Victoria, British Columbia. Call sign is Victor Echo 7, Bravo Sierra Papa. And it's about 80 degrees here this morning on my balcony facing east as the sun is coming up. And from a COVID standpoint, our vaccination plans here on Vancouver Island were north of 60% on first doses. And our second doses are now starting to climb rather quickly. And the province as a whole, our statistics were falling quickly from where we were just a few weeks back in terms of hospitalization, incident or positive tests, and so on. And so things are looking up as we head into the summer. Back to net control. Victor Echo 7, Bravo Sierra, Papa.
Hey, okay, Victor Echo 7, BST, WAONEXA. Very good. I'm glad to hear. I know that you guys had problems getting vaccine for a while, and I'm glad to see things are turning around out there. And that's right, the sun's just coming up there. So it's earlier in the morning. To give you a little update on Massachusetts, we basically, as Chip was saying, we've been watching the Atlantic also, and you know there's one storm out there that's kind of circling around Bermuda, and we're keeping our eye on that. So we have the same concerns, maybe not as active as you are down in the Gulf Coast, but we watch it too. And you're right. I'm a member of ARES also up here, so we don't use DMR quite yet, but there is a DMR link for ARES. We've been using basically our repeaters and now a lot of simplex, and we're working into the digital realm with a number of the different packet type what do you call communications. As far as the COVID is concerned, it has dropped significantly. The state has opened up, which is true about most of the states up in the Northeast. They've opened up completely, no mask requirement. Churches can go back to their regular services and regular attendance, number of people, depending on how big the church is. We have theaters opening up, and also sports are opening up. Sports, I believe, in theaters do have a maximum percentage, but that's, I believe the last time I heard it was like 50%. I believe it's increasing as time goes by. We're got a vaccination rate of close to 70% first vaccines, and in the mid-low 60s for the second. So we're inching our way there with the 15-year-olds starting to get their shots. As we expect, it's going to kind of push us up to the 70% mark. We have our problems with people that are still refusing it, but we've got to the point where at least the possibility, the danger is more on their part than it is on everyone else's. So we basically are still asking people to have their mask on. Sorry, I timed out. I forgot my own thing here. So anyway, that's where we are here on the East Coast. Today's a cloudy day. We've had temperatures in the mid-70s, and right now it's in the mid-60s. So let's go back to Hilton. Wait a minute. Let's see if there's anybody else out there that wants to check in. Go ahead. Okay, not hearing anything. Hilton, do you want to say anything? Back to you, WAONEXA.
Okay, W1EXA and or the DVNet group. This is PY2BBQ Hilton returning. Very nice American, and very nice all the comments from many parts of the United States. I enjoyed to know that the life is coming back to normal. That those are great news, and that you are probably reaching in a few more weeks or a few months the herd immunity. That's a nice discussion about the herd immunity because we need to add to those that have already received the two doses of the vaccines. We need to add those that have already been infected by the virus. So here in Brazil, we have only 10% of the population that received the two doses of the vaccines. That is about 20 million people. And the 40 million people received only one doses. But we think that about 15% of the population have already had contact with the COVID-19. So we need to add that 15% to the number in order to reach the 60 or 70% of immunized people to achieve the herd immunity. Wait one. Okay, PY2 BBQ returning. So one other point for discussion is that this virus can behave like the influenza virus, and we may never achieve the herd immunity because of the constant mutations of the virus. That's another point for discussion, and that we may need a yearly campaign of vaccination in the whole world to control this pandemic. That's another issue to be discussed. So perhaps we will have a vaccine that will protect us against all the coronavirus. That would be the best scenario. So that's the story. Back to you, Mark. Whiskey Alpha 1 Echo X-Ray Alpha PY2 BBQ over.
Hey, WA Winnie XA. Very good, Hilton. Yeah, you're correct. That we do need to add on those people that have had experience with the disease. More than likely, they have some immunity, if not total. And I don't believe we're adding those into those percentages. At least I know we're not in Massachusetts. Okay. Steve, are you still there? K3FZT, WA Winnie XA.
Mark and the group, this is K3FZT. I'm here, but just going to say 73. I've enjoyed hearing from colleagues around the country what's going on in their part of the world and their perspectives about it. Thanks so much for this Saturday morning gathering, and thank you, Mark, for convening it for us this week. This is K3FZT saying 73.
Okay, WA Winnie XA. Glad to have you in. We'll talk to you next week and see how things are going, any changes. Excuse me. Jack, do you have anything to add? KD4IZ, WA Winnie XA.
Not really. Like I said, I'm still hilltopping, so I could go away any second. But I have enjoyed this. Thank you very much, gentlemen. Before I said it, back to that.
Well, you're still doing well. So as you're hilltopping, enjoy the day down there. Okay, over to Mark. WA3QWA, WA Winnie XA.
All right, Mark, very fine. Yeah, just want to remind the net that I have a conference server on Nlink, and I stream the Marco audio on Sundays. I know someone else does that as well. I've had a couple of people check in. That's on the Echolink side. Then on the DMR side, I have the International Amateur Radio Physicians Network, which is 312130. You can drop in anytime. I've got physicians around the world. I would invite our friend from Brazil to check in, maybe give us some updates. I've got a number of hams in India that I've been in contact with recently. So it's 312130 is the ID, WA3QWA.
Oh, very good, Mark. Yeah, do we have the time and the day that meets? Go ahead.
Don't have a formal net yet. I was going to hand it over to Jay, but it sounds like he has a lot going on. So I don't have the time to run a net, but I'm still in full-time practice. But if there's anyone out there who would like to, it's finding the right time because it's a worldwide group, and we haven't figured out what would be the best time. I've had some requests from the doctors in India, and as you know, Indian time is a half an hour off of regular time. The entire country is on the same time zone. Over.
I wasn't aware that it's on a half hour. I know the time zones, but I didn't know that it was on a half hour. Yeah, that's going to be a problem because everybody's on different times. To get a time that's convenient for everybody is a real issue. It's either going to be early in the morning or later night for some people, and others will be in the middle of the day. Well, okay. Well, Jay, I think has mentioned it a couple of times, so it is an issue, and somewhat of an issue with this net also. As we know, Richard's waking up over there in Victoria, Canada. Chip, do you have anything to add? N5RTF.
No, I've learned some things this morning. I'm glad that we've got an Echolink net. Please put some information about that onto the email reflector so that everybody can have access to it and learn how to connect up to it. So the more ways we get out, the better. I think this is a strong way of getting new members interested. It was the Grand Rounds was the way that I got introduced to Marco in the very beginning. So the more people we can reach, the better. N5RTF clear.
Okay, WA1EXA. You're right. That's the way that I got involved. Also, I heard Warren on one Sunday morning and didn't know what it was about. Listened for a few weeks and then eventually said something, and I got involved with that, and I've been involved since then. Yeah, and if we can get some people in with Echolink into the Grand Rounds, that would be helpful. And the biggest problem with the Grand Rounds is being able to hear it, and what the service you provide, going through the internet, is sometimes the only way I can hear what's going on. In fact, most of the time, because I'm up in one corner of the country, and I know that Warren is trying to cover the whole country, and most of it is all west of me. There's very little east of me. So I appreciate that. Let's see who's here. WW6AA, Merrill, do you have anything else to add from sunny California?
Thank you. Really, the only thing to add from Southern California is that I'm 3 hours ahead of the rest of you, and so understanding these time problems is significant. This particular net seems to be the only one of the Marco nets that's easy for me to get to. It just requires me to get up a little early on a Saturday morning. And I did have one other comment. Hilton, I really, really appreciate your YouTube Marco net because I get to hear how stupid I sounded on what I said the week before. And in reference to my comment about QRZ, I'm really serious that the more information you put out there, the more personalized we can make this. And I think that making life better requires personalization and extended families. And Hilton, I noticed a picture of you. It looks like you're on a
Okay, Merrill Hilton, you want to respond to him?
Okay, this is PY2 BBQ returning 100% copied. Well, not 100% because I lost your last seconds of transmission, Mario. Whiskey 6 Alpha Alpha, but you were talking about how stupid you sound. No, negative, absolutely. It's very nice, and you always bring very important information regarding ham radio and healthcare and so. And I enjoyed a lot to see your pictures in the QRZ.com. Great page, congratulations. And I think you said something about my picture. Yes, I'm in the sailboat in that picture. And nice information that I read that they're in San Francisco and they're starting BOTA, BOTA activity that is boats on the air, like summits on the air and islands on the air. They will start boats on the air and with activations and transmissions that you need to be sailing while you transmit. So I'll try to do so and participate as well. And congratulations on your pictures. I'll tell everybody from the net to visit Mario's page and the QRZ.com as well. And yes, Mark Whiskey Alpha 3 Q Whiskey Alpha wait one. Yes, regarding the TG312130, yes, I took note of that. And what I'm going to do, I'm going to leave it programmed in my hotspot as a static talk group. So every time I'm in my shack with the computer turned on, I'll be listening to the group, and if there is any activity in the talk group, I'll probably be able to participate. So thanks for the invitation, Mark. So back to net control. Whiskey Alpha 1, Echo X-Ray Alpha, Mark, PY2 BBQ Hilton.
Okay, very good, Hilton. I will just give you a chance to respond to his question about the sailboat. I had not heard about boats on the air. I know about parks on the air. We have that for the National Park System in the U.S. But boats on the air, well, it sounds very interesting. If I hear it, I'll get into it. Or at least I'll listen to it. Richard, I didn't forget you out there in Victoria. Any other comments? VE7 BSP WA1EXA.
This is Victor Echo 7 Bravo Sierra Papa. From a timing standpoint for the net, when we start looking at that on a global basis, I'm with California. We're actually in the same time zone. So other than that, it's been great to be able to connect in today because I haven't been able to the last couple of weeks. And 732 all on net. VK7 BSP, back to net control.
Very good, Richard. I think you said on the side. I think you said you were you're a pharmacist. You're the manager of pharmacy department, and if that's true, welcome, because I'm a pharmacist also. Retired, but I've done a number of different types of pharmacy. Is that true? Go ahead.
Control. I am a pharmacist, and I am the chief pharmacist for the Health Authority on Vancouver Island. And I'm actually not far from retirement, I hope. At any rate, and I've also had a very varied career in association work or National Hospital Pharmacist Society, because my area of practice, of course, is hospital. But I've also done work in retail associations, or National Hospital Pharmacist Society and the Canadian Pharmacist Association and the pharmaceutical industry. Back to net control.
Very good, Richard. WA1EXA. Yeah, my background is I started in retail, went to hospital for a number of years, got into a specialty of psychiatric pharmacy. And then I got involved with managed care, and I worked with Kaiser. I worked with a number of other managed cares, and then moved over to the insurance side and worked with Aetna and with Medco, which was part of Merck, and was managing customers and developing drug plans. So that's been my my background. But I do welcome you to retirement as soon as you can get there. As I tell people, it's very nice to get paid and not have to work. So, is there anybody else that would like to check in before we close the net? I guess we got everybody. Okay, very good. I thank everybody for attending, and I thank the managers of QuadNet and Let Us Do This. We will meet next Saturday, same time, same place. I think Jay will be back, and you won't have to put up with my stumbling. Okay, 73, everybody have a good week, and I hope you enjoyed it. WA1EXA, the theater net, and may leave the QuadNet open to general use. Bye now.
Can I pop in with one additional comment?
Oh, sure, go ahead.
XAA, and this is mainly for Hilton. I just realized it after I got off. And for Mark and Richard, the two pharmacists. I've heard on the grapevine that using the Pfizer vaccine for a second dose for the vaccines which only had the 60 or 70% effectiveness increased the effectiveness to 95%, as if they got 2 doses of the Pfizer. Again, it's on the grapevine, but it may be valuable to you in Brazil. WW6AA is listening.
Merrill, okay, I had heard that too, and I think I read that someplace, although I didn't see any clinical data, which may or may not, I just didn't see it. Richard, have you heard about that at all?
This is VE7 VSP. Yes, there is a study out of the UK that came out about a week ago that suggested that mixing vaccines was safe to do, but the protection against infection data was still yet to come. There is a second study that I came across this past week, and I'm just drawing a blank as to where it was from, and it was indicating that the mix of vaccines with the Pfizer product would indeed increase protection to a much higher level than would have been possible with just the same vaccine alone. So they're thinking that there's good opportunity in mixing vaccines in general, and perhaps more specifically with Pfizer, because that seems to be the one that's being tested at the moment.
Okay, WA1EXA. Okay, now I remember there was in England there were testing for a while just one vaccine of the two when they were trying to stretch their supply, and there were some people trying that, but I think that they pretty much decided that two was needed. Last I heard, anyway. Okay, thank you for that information, and I hope that maybe something that your colleagues may want to look into as far as effectiveness, especially with the strains. Okay, so that's about it. Glad everybody was here. Thank you again. WA1EXA will be clearing the